Sun and sand are typically a winning combination. At a beach rugby tournament this January, Corey Jackson and his teammates were all smiles, at least until the last game of the tournament.
Second half is going in, right for a tackle to stop a guy from scoring, and sure enough, we're going to the ground. I heard the slout pop, and I was like, oh, that's not great.
Corey's injury was one of the most common knee injuries, a torn anterior cruciate ligament, or ACL.
Most of the time when we are talking about ACL injuries, a lot of time that ligament is not able to be sutured back together or sewn back together.
Dr. Richard Ma is a sports medicine specialist at MU Healthcare's Missouri Orthopedic Institute. He prescribed Rehab to strengthen the leg before surgery and used tissue from Corey's quad tendon to reconstruct the torn ACL. But Corey's recovery was just beginning. 3 days a week, you'll find Corey sweating at Mizzou Therapy Services' Human Performance Program. This transitional training program is meant to fill the gap between the end of physical therapy and a full return to sport.
We're squatting, we're lunging, we're hip hinging, so we're doing the deadlifts and focusing more on jumping, landing, cutting.
Over the past decade, rehab for ACL injuries has come a long way. Trainers say they're no longer focused just on the knee, but rather building total body strength to lower the rates of re-injury. And in the lab, more advances are on the horizon. Dr. Ma and a team of scientists are studying donated tissue from Corey and other patients. They're looking for cellular differences that may explain why patients' knees heal differently, and hoping to someday develop a test that could determine when a patient has fully recovered.
We're studying the proteins that people make in their urine to hopefully maybe come up with a biologic test down the road that we can use as an extra metric to assess if a person is ready to go back to sports.
For Corey, the goal is to return to rugby and hopefully helping other patients down the road.
Any pain I can go through now will be well worth it.
Ready to be back on the pitch as soon as his knee and his doctors allow. From the University of Missouri, I'm Teresa Snow.